sexually transmitted diseases, sexually transmitted infections, some that are curable and treatable, and some that are treatable but not curable. At this point, chlamydia, gonorrhea, syphilis, NGU or non-gonorrheal urethritis, trichomoniasis, pelvic inflammatory, all of these are definitely treatable and potentially curable. However, what you need to note at the very bottom of this slide says infections can be treated and cured, but the damage that the disease or the infection does may not be curable. A lot of times when people have things like chlamydia and gonorrhea, it can get to the point where if it's untreated, it can cause severe problems with the individual, including pelvic inflammatory disease, which causes adhesions inside the reproductive system, causes scarring, and it can actually cause people to become sterile. So it's important to know that if it's untreated, it can be worse. It's more than just having an oozing or a leaking or a drip from the genital area, but it can actually get worse and cause other problems. So it's important to know that if you can get one of these infections, you can also get HIV. So it's important to know that we want to do everything we can to prevent that as much as possible. And also note that when a partner is treated, the partner's partner needs to be treated as well. If one gets treated and the other doesn't get treated and then they re-engage in sexual activity, guess what happens? They end up reinfecting one another. So we want to make sure that both partners are treated, or if there's multiple partners in that particular relationship, all partners get treated. So other STIs or STDs that are not curable but are treatable, one is HPV, and we know that there's lots of vaccine promotion going on out there for HPV. There's at least 2 vaccines out there, and they're targeting young boys and young girls that are just becoming to maturity, and it's important to know that if they think there could be sexual activity or even potential of it, then you want to make sure that you protect them any way you can. It is a vaccine. It is good. It's good to actually have that option out there for people. And but once you get HPV, it's usually something that you can carry on. And the bad part about HPV, it can turn into a cancer. Could be cancerous for both males and females, particularly the young ladies with cervical cancer and other type of related incidents. HPV can also cause the genital warts as well, and we want to make sure that people understand that that they can be treated, but most of the time they can have recurrences of that. Same thing with herpes simplex virus. There's different types. You have the fever blisters that are type 1, and you have the herpes simplex virus type 2, and that are usually the genital ones, and they're usually more painful, and they can pop out at any time. But there are wonderful treatments for those that people can take on a daily basis to keep those at bay. And even if you don't have an outbreak, you could still be contagious. And it's important to know that you treat yourself regularly on that one. Hepatitis B is another one that can be treated, can be not necessarily be cured, but can be treated. And there's also a vaccine for that. Unfortunately, there's not a vaccine for HIV, so we want to make sure that what we can do is to get people into care, get people in treatment so they can live a long and healthy life. And it says, there's a question here, it says, is pelvic inflammatory disease an STD? It's put in that category because pelvic inflammatory disease can be caused by an STD, so in some cases, pelvic inflammatory disease is put in that category because it is affected by a sexually transmitted infection, and so it actually has been put in that category because it can be passed on. Pelvic inflammatory disease is the condition that actually happens as a result of these other infections and causes the adhesions. And I've always put this in the presentation because it's important to know that you think you're okay. Many women in America have a condition like chlamydia, don't even realize they have it because there's no outward symptoms, and it leads to the condition called pelvic inflammatory disease. And it puts you more at risk the more sexual partners that you have. And I hope that helps you answer your question. So let's move on to the next slide here. Be careful not to bite off more than you can chew. Getting yourself, if you're on alcohol or drugs, alcohol or other drugs, excuse me, you can put yourself in a questionable situation and decrease your ability to think rationally when you combine that with putting yourself in precarious situations, and you maybe get more than you bargained for, if you get into a sexual encounter, because not everybody that you see can show outward symptoms or signs of HIV or HIV infection. As a matter of fact, it's almost impossible to tell you a specific symptom that HIV or AIDS could present. So it's important to know that you don't want to get out there and do something that you'll later end up regretting. So moving on, HIV in women. A lot of times people will say that women are less at risk at getting HIV if they're having sex with other women. There's an increasing number of women that are actually getting infected with HIV. We spoke about that earlier yesterday when we talked about that the largest group of people that are getting infected are heterosexual individuals, particularly women. New infections are occurring especially among adolescent women and women over 45, with the introduction of erectile dysfunction medications. We're finding that more and more women over the age of 45 are becoming or continuing to be sexually active. And of course, there's a more of a liberation. Women are out there becoming more sexually liberated, and so there are women to explore, willing to explore, just like the men have been exploring. So it's important to know that we don't exclude that group just because they're getting older. Just because you get older doesn't mean your sexual drive stops. So it's important to know that the young adolescent women are getting more and more infected, and it seems like they're connecting with men that are in their 20s and up sometimes, and finding that's how they're getting the infections are across these age groups. African American and Latino women are disproportionately affected. They're affected more than other populations, and then there are many more issues that are facing the HIV infected woman that are out there. Anytime that a person has HIV, any type of infection that's out there, they're more likely to contract. And it's always interesting to know and to note that if a person is HIV positive, that there's more precautions that people need to be taking to help themselves stay healthy. Reducing risk. What about the women who have sex with other women? There are cases. There is a case that's been proven many, many years ago that it can be passed on from one woman to the other. Again, the exchanging of bodily fluids is the key thing, because they can be present in most sexual fluids, most all sexual fluids. It's not in urine, but it is found in vaginal secretions, cerebrospinal fluid. It's in pretty much any internal fluid. Again, the exception is with sweat, tears, and saliva. That's the only bodily fluids that it does not contain the significant amount of HIV to be able to pass on. So it's important to remember that what the fluids that do and do not pass on HIV, blood is definitely number one up there with the fluids that can be passed on. But again, seminal fluids from the male, vaginal secretions from the female can pass these on. Everything's not always as they seem, and we're going to move on past that. If we're talking about HIV prevention and drug use, definitely sharing of needles from one person to the other, as we mentioned briefly yesterday, can definitely pass on HIV and hepatitis C, hepatitis B, hepatitis C. Bleaching of needles and washing the needles is definitely a great alternative. If there's a needle exchange program in that area where a person brings in a dirty needle and gets a clean needle, and there's that question over whether they're promoting drug use or not promoting drug use. In this particular presentation, we're not promoting drug use. What I am trying to do is promote the cessation or the stopping of HIV transmission, which is what we're trying to focus on here in this particular presentation. Alternatives to drug use. If a person is not going to stop using drugs and they're not ready to stop, and you're trying to counsel with them or talk with them about it, and you're trying to prevent HIV transmission, we know that needles are a definite way to share. If you're sharing of needles, is definitely a way that person can pass them on to a dirty needle to another person. Then encourage them to, if they're going to get high some other way other than using needles. These are ways that I'm, again, trying to encourage stopping HIV transmission, not promoting drug use. So let me make that clear. All right. if for some reason a woman is breastfeeding and working in public health, working in rural health, breastfeeding is definitely one of the best things that you can do for your child, and I do encourage that in every sense of the word of encouraging healthy mothers and healthy babies. But in the case of a person who's HIV positive, we do not encourage breastfeeding because if a child is born to an HIV positive parent, the child does not have to be born with HIV. And in many cases, they may not be born with HIV, particularly if they've gotten on early treatment, medication for the mother, medication for the baby, the infant, both before and after. The treatment continues after the child is born. Then the child is born without HIV, the HIV negative. And we don't want this to happen when a woman decides to breastfeed, and it could pass on through the mother's milk and through the breastfeeding process, blood getting exchanged through the breastfeeding process from the mother to the child. We want to make sure that that doesn't happen as well. So we do not encourage breastfeeding if a mother is HIV positive. It can be passed on from mother to child through the birthing process and through the pregnancy. So we do definitely want to make sure that we encourage people to get tested if they decide they want to get pregnant and they're not sure of their HIV status. It's always, always, always a great time to encourage a woman to get tested. And in North Carolina, that is a standard practice that that a woman gets tested in the first and the third trimesters. And so we still encourage that. They still have the right to refuse, but we want to encourage people to get tested. That way they know that they don't have to pass on HIV to their child. No donating blood or blood products or organs or tissues if a person is HIV positive. We did show one yesterday where they did their first transplant from an HIV positive person to another HIV positive person. I guess that's brand new. That just happened in 2016. So that's even new for me. I hadn't heard of that yet. But they still don't encourage donating blood or blood products or organ tissues, even plasma. We want to make sure that we don't transmit HIV through having the donated materials. All right, we've already gone over that one, so I guess I've got some duplicate slides in here. All right, acute infection. When is it the flu and when isn't it? I mentioned yesterday that after about 2 to 3 weeks after a person gets initially infected, they'll have a severe case of the flu. And it should seem to be one of the worst cases of flu the person's probably ever had, unless they've had infections and flus like that all of their life. But when is it the flu, when is it not? This is a great opportunity to talk about risk reduction counseling when a person does come in and talk about they're having the flu, ask them questions. And you know, we don't try to offend somebody, but we want to make sure that that's not an HIV infection because we don't know who has been infected and who has not. Many people that's come through our health centers, we found on our routine testing to be HIV positive did not know that they were even at risk because we did routine testing on everybody that came through our doors. So it's important to ask those questions. All right, heard that. Hope y'all heard that. Somebody was calling in, another participant. Yay! Important to know that this is a time that we can talk to people about early intervention and getting them into care as quickly as possible when we find out that this is a good opportunity to find out if we need to test them or not. In acute infections, it happens 2 to 4 weeks after initial infection, like it says here on the screen. HIV reproduces exponentially. It's not one-to-one. When it reproduces many more than its own self. And the body begins fighting the infection, resulting in a flu-like episode, extreme or bad case or worst case scenario of the flu. During this acute phase, it could last up to 3 months for someone that tests positive for the virus. And that's pretty bad. That's pretty bad, especially now when we're having people that are being sick for at least 3 weeks at the time. Are they sick with the flu, or could they have gotten infected? And you don't want to assume anything, but you definitely want to leave that out and miss an opportunity to get somebody tested. All right, clinical latency. When a situation when a person's already been infected and the flu-like symptoms go away, it could take between 8 to 10 years for someone to to show outward symptoms of HIV, because there's no one set of symptoms that says this is HIV and this is HIV only. These actually mimic other diseases. And anybody in the crowd, if you think about it, have you ever had fatigue? Have you ever lost weight, unexplained weight loss of 10 pounds greater or more? Have you had night sweats or fevers? Have you had nausea, vomiting, and diarrhea? All these could be signs and symptoms of HIV, but they could always be signs and symptoms of some other things, some other conditions. A stomach virus or the flu or some other type of things. A bad episode with diabetes can cause severe profuse sweating. So we want to make sure that it's not these things. So in a clinical latency, again, you're asymptomatic. You don't show any symptoms because it produces more slowly once your immune system kicks in. If you remember that slide where we had the blue and the red lines yesterday, when the immune system kicks in, it starts working and starts fighting against HIV, and of course HIV reproduces much slowly, but it never stops. So depending upon an individual immune system, it could be more or less years and before it actually shows up. HIV, the stages. AIDS. It's a person's immune system is probably no longer viable. It's starting to weaken immensely, and the helper T cell or the CD4 cells fall below a threshold of 200 cells per millimeter cubed. And so during this phase, people will begin to show outward signs of a weakened immune system through outward manifestations of what they call opportunistic infections. It's infections that may have already been in our body. Most of us have infections in our body all the time, but our immune system is so strong it's fighting it off all the time. Most of you probably don't even aware that you probably being infected with something and you don't even know it, like CMV or something along the lines of another type of infection, and because you have a strong immune system, it's not affecting you, but you may be a carrier but not even realize it. So it's important to know that when you get a weakened immune system, that's when it starts showing up, and these what they call opportunistic infections. These infections take the opportunity, since your immune system is weak, to actually show themselves. So these infections are those that would normally be absent in a person, again, whose immune system is healthy. How does it affect a person? HIV, it causes fatigue, depression, hypogonadism. It can cause insomnia, chronic pain. It can cause neuralgia, avascular necrosis, peripheral neuropathy, nausea, diarrhea, fever, night sweats, delirium, dementia, weight loss. And some of this, like I said earlier, it can mimic some other conditions that we may have. So how do you know if it's HIV or if it's HIV or not? Again, there's no one way to know that it is HIV or it's not HIV in a person's system. The only way to truly know is if a person gets tested for HIV. HIV, how does it affect the person? Lipodystrophy. It'll redistribute fat inside your body. It'll move it from one area to another. A lot of times you'll find that your midsection will be getting larger. And some of us, as we're getting older, we have that problem anyway, so we have to work harder at getting rid of that. So it may not be HIV. Sometimes it's just the aging process. But a person who has HIV, it will actually redistribute it. It also redistributes some to the back of the neck, and we'll call that a buffalo hump, some may call that. It also causes your cholesterol to be extremely high, which is hypercholesterolemia. In addition to that, the medicines that are given for HIV also increases your lipid counts or your cholesterol counts, and so it's one of those things that has to be monitored on a regular basis. HIV can cause pneumocystis pneumonia, and it can cause something called Kaposi sarcoma. Some of us may have Kaposi sarcoma, and it never ever affects us. It's a cancer that you'll see purplish splotches on the bottom of your feet first and on your hands, and it can cause the cancer can spread throughout the whole body, and it's a very, very bad cancer. But typically a person whose immune system is strong, you'll never have the outward symptoms of Kaposi sarcoma, and you'll never even have any problems with it. I mentioned CMV or cytomegalovirus earlier. How about Candida? That one is yeast infections. I know some women suffer from yeast infections vaginally, but this is one where not only you have more vaginal infections with yeast infections, but some men and women will actually start having yeast infections in the throat. They call that thrush, and it will be more prevalent in those that have HIV, when their immune system is weakened. How does it affect the person socially? It can go socially, medically, psychologically, mentally, emotionally, physiologically, financially. It's very expensive to get treated for HIV. That's why if there's a Ron White program in the area, it's good to be connected with that, because it can help a person with those costs. It can cost upwards of $20,000 a year just for the HIV medications, much less the over-the-counter medications for the signs and symptoms that we have for nausea, vomiting, diarrhea, and the day-to-day activities. Socially and societal, there's a lot of negative stigma out there, people that are put down, that are discriminated against because they're HIV positive. We all need to get educated on HIV, how it is and how it is not passed on, and what we can do to stomp out ignorance and stigma associated with it. Medically, a person needs to be treated. They can't go without HIV treatment. They need treatment. Psychological, a lot of people that are HIV positive need psychological, like maybe counseling. It's a very traumatic disease to get, and many people still think it's a death sentence. It does not have to be a death sentence, and they may need mental or emotional support. Many people in our area, their families have disowned them, turned their back on them, and they have nobody to turn to, and many times it's us, the healthcare providers, to be their emotional, mental, and even psychological support. Physiological, it affects the body in many ways. We talked about the inflammation that happens all over the body. It affects every organ, every tissue within the body, and so we need to make sure that each one of their providers speak with one another to make sure that they understand that one system affects another system. So this is definitely a systematic approach to a person who is HIV infected, to make sure that all of those systems are being cared for and treated completely. What happens as our healthcare guardian? This is Robinson Healthcare's take on this. And yes, I'm an advocate for Robinson Healthcare. Not only do I work with them, I actually promote them because they are one of the few Ron White providers in our area. Between Charlotte and Wilmington, Newton Grove, and Florence, we're the only Ron White provider that provides the services that we provide outside of the health department that does provide infectious disease only care, the local health department in Robeson County. And then Southern Regional Area Health Education Center in Fayetteville provides Ron White infectious disease only care, but they don't provide the comprehensive care that we have, so we have a little more flexibility with the services that we provide. We do work in tandem and in concert with the health department and SRAHEC, and try to make sure that we complement one another's services without duplicating or leaving gaps in services. We're not in competition with them in any way, shape, or form. Let me make that clear. We are working together to eradicate HIV once and for all. So it's important that all individuals, regardless, should be routinely tested for HIV, just like getting tested for high blood pressure, diabetes, high cholesterol, all those things. If you fit in any of these categories below, then you should be tested for HIV. If you or anyone you know has ever been once engaged in a type of sexual activity, either willingly or unwillingly, unfortunately there are people in there that have forced themselves on others. They need to be tested. Sharing needles, whether legal or illegal drugs, and having been exposed to someone else's blood or bodily fluid. It does not have to be sexual. Again, we can be playing on the playground and young Johnny gets hurt, and Susie, Sally, and Freddie comes over there to help him. Johnny's got this big gash on the head. We don't know that Johnny's HIV positive or not, or has any other infection, and all we want to do is help that person because we feel that they need help. We need to be careful on that on our playgrounds and make sure that people are not touching other people's blood or bodily fluids. Testing. Important to know that you can take advantage of early intervention and treatment. Testing can be found if you can go to hivtesting.org, or Google HIV testing in your area. It can come up and you can find ways to get tested, where to get tested, if it's a quick test or if it's a regular test, if there's fees attached to it. Take time out to do that and share that with other people so they can know where they can get tested. In North Carolina, HIV testing is confidential. It is not anonymous any longer. That way they do track in the event that there is someone that is positive, that they can contact their significant other, their partner, and that is confidential. They're not going to tell you, hey, Al Bishop is positive and you need to get tested. They'll say that someone that has named you as a partner was tested and found out that they were HIV positive and that they recommend you getting tested. There are ways to do that and try to keep everybody as safe as possible. And we do take confidentiality seriously. We work with our local disease intervention specialists, with the local health department and the state health department. We work in tandem with them. We work in concert with them, and to make sure that we can reach out and connect with those that may be infected so they're not continuing to infect other people, or so they can get treated themselves. Know whether or not you can infect others. That's the good thing for in getting tested. Increase commitment to good health habits and decrease anxiety, prevent transmission to your baby. I don't know about you, but if I had a baby that I was going to have a child, I want to make sure that my baby did not have to be born HIV positive. Excuse me there. What's the downside? Is it can cause increased anxiety, depression if positive. Risk of job insurance discrimination, unfortunately, it's still out there, and people are still getting discriminated against. Rapid testing screenings, there are different types. There are finger sticks, there are oral mucosa tests, there are some urine tests that are still out there, and most of these tests are 20 minutes or less, and you can find out your test results that quick. Pros and cons of rapid testing and pros and cons of traditional testing. The traditional testing is that you don't have to find out right now, and the downside to it is you have to wait a week or so to find out if you're tested or not. One thing about traditional testing is that it's already confirmed when you get it back. If you're rapid tested, you have to get tested a second time to make sure that the test is 100%. Rapid testing, RHCC does offer rapid 10-minute testing at all of our local health centers, and we offered ages 13 to 64. In some cases, we'll go up higher than 64 and lower than 13 if necessary. And all pregnant women, first and third trimesters, are tested. This goes along with the state guidelines. Individuals with a history or presentation of a sexually transmitted infection will be tested for HIV or offered testing, and we still encourage it. We can't force testing on people, but we do strongly encourage it. Positive test results means that a positive person does have HIV antibodies in this system. In some cases, we do have tests that actually looks for the antigen, which is the actual infection. An antibody is something that our bodies produce as a result of something being in our body or infection that's in our body. And number one, it also, if a positive test result comes up, that means you can infect someone else. It does not mean that you're going to contract HIV or get into the AIDS condition. It does mean that you're at risk for that if you don't get care and treatment. And it does not mean that you're immune to AIDS even though you have antibodies. We don't want to make sure that anybody's confused about that. Negative test results means that at this time no antibodies were found in your body. If it's an antigen test, meaning that looking for the actual HIV infection, it does not mean that you're not infected, but at this time we cannot find the antigen in your system. It does not mean that you're not infected with HIV. It does not mean that you're immune to AIDS. It does not mean that you have a resistance to the infection, and it does not mean that you will never get AIDS. It just means that it has not been found in your body at this time. Some will ask, is there an incubation period? Most of the tests are good up to as little as 18 days from the time that you were infected. You can pick it up that soon. Some of the more sophisticated ones can pick it up in a little sooner than that, maybe up to 15 days. Most of your tests, at the very least, will get it in up to 3 months. So what's recommended is you've been tested and you're not HIV positive. We like to give a 3-month window or a 90-day window to tell people. How accurate is the rapid oral HIV test? It's not as accurate as the blood test. It is 99.5% 99.6% effective. It may be as low as 98%, but for the most part, it's pretty accurate. We like to offer the oral rapid test when we have them. We don't have them at this point, and the state does supply those for individuals and organizations. The rapid test is fairly accurate, but to be on the safe side, we do recommend that a finger stick or a venous stick be done and blood be used. So the oral rapid test is fairly accurate. It's in the upper 98 to 99% effective at getting a accurate test, both positive and negative. Make sure we don't have false positive or false negatives. But if you look at it like this and say, well, if a person's not going to get tested unless they only do an oral rapid test, let's do an oral rapid test. People sometimes opt to do it because they don't like blood, they don't like their finger stick, they don't like to get the venous stick. We do let people know that if they get a positive oral test, we have to do a venous stick or we have to do a finger stick. And so in most cases, we're glad and happy to do that if we have those available, because a test is better than no test at all. But it's pretty accurate. It's actually pretty accurate. I hope that answered your question. And thank you for the question. So if a person's positive, if you are positive, again, we want to encourage people to get emotional support, medical care, and make sure that people understand about our treatment programs, not just ours, but any program that's out there. If you have a program, another one of the services of a Ryan White program is that we can help you connect to another program where you may be living. So many of you may be from various parts of North Carolina. We can actually help you get someone connected. We recently got someone connected to out of state and find a place where they can get tested in all 50 states and in some of the territories of the United States, including Puerto Rico and some of the outlying areas. So we can help people get connected, and with these treatment programs, we encourage people to get behavioral health treatment as well as psychological, mental health, substance abuse programs, get other types of care as it is needed for that individual. CDC recommendations for HIV testing, we went over some of those already, and we're just emphasizing that we're lining up with what the CDC wants, so the Center for Disease Control. And now we want to talk about, just briefly, who is Ryan White, because we're talking about Ryan White CARE Act, the Comprehensive AIDS Resource Emergency Act. Ryan White was a young man that contracted HIV, through blood transfusion. He suffered from hemophilia, which was the blood clotting, clotting disease, where his blood didn't clot properly, so he had to have blood transfusions on a regular basis. And because of his situation being a young person that was not the stereotypical gay white male in America, he was became basically the poster child for HIV and AIDS because he did not fit that mold as, oh, it's a gay disease, and you got this because you were gay, you got this because you were homosexual. We want to let people know it's not a homosexual disease, it's a human disease that can be prevented and can be passed on to anyone through bodily fluid exchange. So Ron was one of those children with hemophilia, again diagnosed with AIDS at an early age as a teenager. His mom and himself courageously fought AIDS-related discrimination and helped educate the nation about HIV and AIDS. He was from Kokomo, Indiana, and was attending Western Middle School and suffered much discrimination and prejudice because of his condition in the schools. He was diagnosed with AIDS at age 13. He and his mother, Jeannie White Ginder, fought for his right to attend school, gaining international attention as a voice of reason about HIV and AIDS. At the age of 18, Ryan White died on April 8, 1990, just months before Congress passed the AIDS bill, or the HIV bill, that named the Ryan White CARE Act, or the Comprehensive AIDS Resource Emergency Act. And his mother is still active in HIV prevention and promotion of stopping this disease. As a matter of fact, she will be in Florence this Friday evening, and I have information about that. So if you're interested in that, please let me know. My wife was working down there in Florence and found out about it, but she will be doing a discussion talk or what have you this Friday evening in the Florence, Darlington area. One of the centers down there. And so if anybody's interested in that, please let me know and I can forward that information to you. The Ryan White CARE Act legislation has been reauthorized in 96, 2000, 2006, 2019, 2013, and it's now called the Ryan White HIV/AIDS Program. And we're proud to be Robinson Healthcare and other places like Commonwealth Health is proud recipients of that and proud to give those things. The reason why I named Commonwealth Health, or used to be Tri-County Community Health Center, is we work in tandem in partnership with them for the Ryan White programs as well as Part D services for women, infant, children, and youth, along with Part C, comprehensive care for people that are affected with HIV. So Ryan White Care, the majority of the Ryan White funds support primary medical care, central support services, and a smaller portion is for technical assistance, clinical training, to make sure our providers and staff stay up to date with the latest technology, the latest techniques, and the latest treatment for HIV and AIDS. There's a number of different programs under this act. And with that is Part A, Part B, Part C, and Part D. Part A is for metropolitan areas, and we have eligible metropolitan areas and transitional grant areas. Until 2006, 2007, North Carolina had no Ryan White Part A funds, which are in the millions of dollars, $2 to $3 million worth of money. In 2006, 2007, legislation was passed that we had. It opened up the ability for us to be considered a metropolitan area at Charlotte. So Charlotte now receives Part A funds, which is very broad in nature and can help a large portion of the population that lives in the Charlotte, Mecklenburg, and around 9 counties in that area, including 1 county in South Carolina. Part B provides grants to all 50 states, the District of Columbia, Puerto Rico, Guam, the U.S. Virgin Islands, Pacific Territories, and associated jurisdictions. It is designed for direct patient care and infectious disease care. It also houses what we used to call our AIDS Drug Assistance Program, and now it's called HMAP, I believe it is, which is HIV Medications Program, and multiple levels. So if you're getting treatment from a provider and you get this prescription, somebody comes in and says, okay, here's your prescription, it'll cost you $2,000. And you're like, $2,000? I don't have $2,000. How am I going to pay for this? I don't have any insurance. Or it may be $3,000. And they say, well, $2,000, is that for a year? And they're like, no, that's for this month. So HIV medications are extremely expensive and one of the most expensive out there. Some oncology medications are higher, and of course hepatitis C treatment has higher, but these are still one of the highest cost medications that are out there. And this Part B funding for North Carolina, and each state has their own program. For most states have their program, but under the Part B program, this is where most of your monies go to for getting medication access. In addition to other things that are going on, this is what Part B covers. Part C is a comprehensive look at health care. That means it looks anything from cuts and scrapes and bruises to any type of condition that is associated with HIV or AIDS or the HIV condition. So it can actually cover a cost, including transportation back and forth to get your health care services, to getting insured for some. It can also cover the cost of medical case management, you name it, lots of stuff that can be done. Part D is family-centered and does focus on women, infant, children, and youth, and looks a lot like Part C now. And we're fortunate to have those in our rural areas. Part F is another part of it, and that's the education and training portion. It also does special projects of national significance. We had one when we first started in Robinson County that focused on Native Americans and American Indians and HIV, and you wonder where you get your your specific population information. Projects like this, there's one that went on not too many years ago for the homeless population and HIV, and trying to get that targeted information. This is how this happens, is get targeted information from programs like these. AIDS education and training centers throughout the United States help to provide training for those that have the Ryan White programs to keep them up to date on top of the latest technology and techniques that are happening, dental programs that are out there, and of course minority AIDS initiatives. And we are fortunate to have those available funds because we do have a large population in North Carolina and southeastern North Carolina that are minority populations that are suffering and or living with HIV. Ryan White Care Act is administered by the United States Department of Health and Human Services under the Health Resources and Service Administration, and we receive them directly from them. Ryan White Care Act Part C, some of the things that you'll see on your screen or some of the things that can happen that can be the monies can be used for, and it's a direct provision of medical care. And for Part C, at least 6% has to go to direct patient care, to medical services. It includes things like primary care providers, the labs, x-rays, other diagnostic tests, medical and dental. It's important to know that if you're HIV positive, to make sure that you get dental care as well, because if an infection happens in your mouth, it goes directly into the bloodstream and it affects your system. Medical case management, electronic medical records, it can help us to make sure we maintain those. It doesn't play for setting up those, but it can help us in some cases to make sure that we continue to have good records kept so we can track the care of our patients. Patient education, especially when provided in conjunction with medical care, which is always a good thing. Education can never be given enough. Transportation we talked about, and other clinical and diagnostic things that patients may need. Other things that can happen, the monies can be used for HIV counseling, outreach, testing, certain medical care services that have historically been paid for by Parts A and B are only provided by Part C with justification. For example, the AIDS Drug Assistance Program we talked about earlier, now it's called HIV HMAP now. Health insurance premium costs can be covered. So yes, we can cover insurance premiums, particularly when the Affordable Care Act came into act and required people to have insurance. If you're HIV positive and you qualify, then it could cover those costs as long as the cost is not more or greater than having the cost paid outright. Home health care costs, hospice services, and even home and community-based health services defined under the Part B Ryan White Care Act. Ryan White Part C also has other things like support services, patient transportation, as we mentioned before, staff travel to provide services, so going back and forth between places that actually healthcare service center sites. We can help to cover those costs, outreach to identify people that are at risk of contracting HIV, educating them about that, translation services, patient education materials, statewide coordinated statement of need processes so we can coordinate with the state. When the state has a plan, are we following that plan and how do we fit into that so we can be more effective overall? Patient advocates to maintain access to care. Who can be a better advocate than someone that's already HIV positive, that is doing well and can show evidence that I can live a healthy life, you can live a healthy life as well. Respite care, it can help to cover things like respite care as well. What about HIV infectious disease care? We know that's kind of a duh, I knew that, but we want to make sure that people understand that it covers the infectious disease care, but it also covers primary care as well. And if you're in the Ryan White Part B program, which is the infectious disease only care, it requires you to have a primary care provider. In some cases, we can coordinate that care as well. We can have it where we can have someone going to Part B for their service and maybe come to us for the Part C only. It's interesting to know that we can keep those, we have to keep those things separate. We don't want to overlap those, but we want to make sure that we complement those and make it clear to understand that we have to work together in order for us to be effective in our communities. And it takes people like everyone that's on this webinar today to make a difference in our communities. screening, triage, and referral. We want to make sure that not only we screen them, triage them for if they're positive or not, but make sure that we get them into care immediately and urgently. Don't wait. Don't let them put it off. Let's try to see if we can get them into care. Our goal, if they're tested with us or if they're tested, a lot of times we work with the local health department. We work with other entities within our communities and try to see if we can get them into care. If not with us, with the health department. If not with the health department, some other agency or organization just as quickly as possible. The sooner they get into care, the sooner they get treatment, the better off the treatment options are. I remember working in the BSEP program, or the Breast and Cervical Cancer program, many, many years ago, and one of their slogans is early detection is your best protection. This is the same thing that we need to push for HIV care. Early detection is your best protection. Get people early into care, early into treatment. They have better treatment options, live a healthier, happier life. Many years ago, when I was first started in HIV care, we were trying to get people to have longer lives. So we looked at the quantity of life rather than the quality of life. As treatment options got better, not only did the quantity of life increase, the quality of life increased as well. And getting people into care early, getting them better treatment options, this definitely improves not only the quantity, but also the quality of life. So Ryan White also can offer oral health care options, ophthalmologic care, diagnostic care, chronic and acute care for those infected with and affected by HIV and or AIDS. Again, medical case management, helping to manage their case along the way. Also, access to discounted medications. If you can get into a program that has a 340B, which is out of the Office of Pharmacy Affairs, which is part of the Bureau of Primary Health Care, they actually offer discounts straight from the manufacturer to the individual pharmacy and pass on those discounts to those that are receiving those medications. 340B is not exclusive to HIV programs. It's for any federally qualified health center that receives funding from the federal government. So if you can get into a program that has a 340B pharmacy, you're actually helping them out and helping yourself out. So look those up. We talked about ADAP or HMAP, and then PDAP, which is a prescription drug assistance program. We do have those where we go to the manufacturer's websites and get the discounts and try to help people find those discounts. We work the manufacturers to find any discount cards, discount coupons that significantly reduce the copay cost. So even if you have insurance, it may be where your person can use those discount cards to get greater discounts even on their copays. So say some of us may have a $5 copay, a $10 copay, or even a $100 copay. Some people with HIV medications can have a $100 copay, a $200, $300, $400, even a $500 copay. Could you imagine having a copay of $500? Some of these programs can actually help cover those costs. It's good to know that they have programs out there, but our teams like to make sure that they know that with us and other programs across the United States, we try our best to find the ways to help get those medications to those patients at a low cost. And a side note, even without HIV, many of you can go to places like MediaMed.org, RxAssist.org, and get discounts and discount programs for those that have problems getting their medications. And it does not have to be HIV medication. It's pretty much any medication that's out there. There's typically some type of program that will help that. So just a tidbit, just to pass that on to someone, if you're use a little wisdom and a little initiative, you can go out there and help those, particularly those that are elderly and on a fixed income. Even for those that are not elderly, there are programs out there from the manufacturers and other third-party individuals that can actually get your medications at a discount. That's a tidbit of information. I give that to you for free today. Also, what else do we provide for you as a Ryan White program? HIV diagnostic and entry into care, HIV screening, recruitment, and retention of patients. We want to keep them once we get them. Non-traditional test sites, 10-minute testing at all of our sites. 20 minutes is the longest that you would have to, as the test takes. It may take longer than that by the time you get enrolled, get in and get your test and then wait for your test results, but the test actually only takes that long. Here's some of the sites where we can be located just in case you're in the area. Stop by, let us know, talk to us, say, hey, I heard about this and want to know more about what kind of service you can provide. So let's move on. HIV rapid testing, it's important to know that we do offer those, and I said 13 to 64, but we actually increased it to 13 to 70. And we want all pregnant women first and third trimesters, and of course individuals that present with a sexually transmitted infection. I put that on there because I want to make sure that we're aware of that. We've already had that slide, so we'll go on. We do have case management agencies in our area. It's not just us. Border AIDS Resource Team, or BART, they're a case management agency. Robeson County Health Department has HIV case managers. Robeson Healthcare Corporation, there's others in the region. Other resources, HIV providers in Robeson County Health Department, they have the ID clinic I talked about earlier. It's a Ron White Part B service for indigent and insured as well. Robeson Healthcare Corporation, Southeastern Regional Medical Center has an ID provider on staff. We also have Acme Medical in the area that is an HIV or it's an infectious disease and gastroenterology providers in the area. Regional clinics include the Southern Regional Area Health Education Center in Fayetteville, North Carolina. Commonwealth Health has locations in Newton Grove and surrounding areas. They have Part B, C, and D. Hope Health in Florence has Ron White Part C services. Wilmington, Charlotte, and other parts of North Carolina have it. And if you need to know, you want to know where those are, please give us a call. Let us know, and I can show you how to get those. And Dogwood Healthcare Network is located at Robeson County Health Department. It's a regional group that comprises of the ID clinics and other providers. This is groups that get together and talk about how we can be effective in our communities. And then there's the Coastal Care Network in Wilmington, same as above, it's just is in the Wilmington area. And there's all these across the United States. Other web links, these you can see on in your handouts when you get those. Be helpful and help you to find out more about HIV and AIDS information in your area. More, AIDSinfo.net, treatment options, different organizations that are out there that can give you information and help you to get the information you need. Tuberculosis. Tuberculosis is particularly important to know that if a person is HIV positive, they must be tested for tuberculosis just because they have HIV, they're at greater risk for either developing a tuberculosis infection or reactivation of a previous infection that they really don't even know they have. So it's important to know that this Mycobacterium tuberculosis can affect a person, and even greater. Tuberculosis is one of those infections that is one of the only infections that are at least in North Carolina, that you can still be quarantined, held against your will, and made to take the treatment or incarcerated, whichever the case may be. Why? Because this infection is so easy to pass on. All you have to do if you have an active infection is cough in the air, and it can stay airborne for up to 20 minutes. So you can leave the area and come back, or somebody can come through this area within 20 minutes, breathe in the materials that have been coughed out, and get infected with tuberculosis. That's how dangerous this infection is. Tuberculosis is, it gets in the lungs, and it can get into other parts of the body. I didn't realize that, but I was found out that it can actually get into other parts of your body, and it can be actually cause you to be sick and can cause death if not treated. Everybody that works in healthcare should be treated, or should be tested for tuberculosis, but a person that has TB needs to be treated as well. And the health departments typically are the public health authority that will be doing the treating, and they must follow those until the end of that treatment series. Tuberculosis is a very serious disease worldwide. Almost 1/3 of the population has it and is infected with TB. And although a healthy immune system can prevent active TB, it is important that you get tested at least annually, or when you show signs and symptoms, or when you know that you've been exposed to someone who's had active TB. 2 times of TB, of the primary TB, occurs soon after a person is first exposed, or reactivation. What happens is the immune system is weakened. The TB can break out of the tubercles and cause the active disease. And the most of TB in a person with HIV are due to reactivation of a previous TB infection. Tuberculosis symptoms. Active TB can cause the following signs or symptoms: cough that lasts for more than 3 weeks, weight loss, constant fatigue, night sweats, and fevers. Didn't these mimic the same thing that HIV could do? Again, a different condition completely, but has the same symptoms. Again, another reason why there's no set way to know that a person has HIV because of their outward symptoms. These are much like the symptoms caused by the PCP, but TB can happen at much higher levels of a CD4. So even PCP happens, or the pneumocystis pneumonia happens when your immune system gets below 200. The CD4 drops below 200. We talked about earlier, the white blood cell count. But TB can happen at a much higher level. So you can still be sick even though your immune system is fairly strong. Tuberculosis transmission can be transmitted through the air when someone coughs or sneezes. Again, it can be easily developed if you have advanced HIV disease or if you're exposed to a very infectious form of TB. We're finding out now that there are some strains that are resistant to antibiotics, and it takes longer for a person to get over TB. So it's important that we know that a person that is TB positive to be treated until it's considered not infectious any longer. Hepatitis. Hepatitis is another condition that is very serious to a person who is HIV positive. If you have HIV, then you're more likely to develop hepatitis A, B, C, D, E, and G. Doing our research on this many years ago, and we found out there's more than just A, B, and C, but A, B, and C are the ones that we hear about. And hepatitis attacks the liver, and it does damage to the liver and can lead to liver cancer, cirrhosis of the liver, and end up in death if it's not treated. What's important about this is if your liver shuts down, guess what, folks? You shut down. It's one of your filters of your body. Every part of the blood that is in your body always, always, always goes through the liver and is filtered through the liver. What happens, what is hepatitis A? Hepatitis lives in feces in the intestinal tract, spreads through contact with feces and not cleaning hands or baby diapers. And so it also happens through sexual practice where the mouth and the rectum, the anus, or the penis, rectum, and mouth contact with one another. And also can be through contaminated food or water that is in contact with raw sewage, raw partially cooked seafood that is in contact with raw sewage, but can be easily prevented through vaccinations and through universal precautions. Now, when you see those signs in the restaurants, I'm not going to ask you to raise your hands because obviously I can't see you raise your hands, but how many of you out there read those signs when you go into your restaurants and you see that all employees must wash their hands thoroughly before, once they leave the bathroom or after smoke breaks? Okay, I see in my mind many of your hands going up because most of us all see those. Why do you think that is? Well, that's because hepatitis A can be passed on from person to person. There's other infections, and I won't get into a whole lot of details, but many, many years ago, there was an outbreak of chlamydia or gonorrhea in one of our small local towns. This is when I was a young man, many, many years ago. And I say many, many years ago because I find myself getting older and older every day. And what was happening at the local restaurant, there was an employee that went to the bathroom, had a case of gonorrhea or chlamydia. I can't remember which one it was, right off the top of my head. And they were the dishwasher. And they were the ones that were responsible for getting the plates out of the dishwashing machine, the commercial dishwashing machine. Well, what does chlamydia and gonorrhea, what they like to stay in? They like to stay in warm, air-free, moist areas. That's why they breed very well in the urinary tract and the vaginal tract of human beings, because it's warm and it's moist and it's without air. So when you put those plates together that have freshly gotten out of the dishwasher and they're still slightly moist and the plates stick together, they make an airtight seal between the layers of the plates. So they're almost like a petri dish. So what was happening was a person didn't wash their hands after going to the restroom, got chlamydia or gonorrhea on the plates while they were handling the plates. And I know some people are doing the ooh and the yuck and the can't believe that, because I would be too. And people were actually getting infected with chlamydia and gonorrhea through that with oral. They were getting it orally, of course, because the plates were serving as petri dishes and were breeding the infection. that's nice to know. That's another one of the reasons. But also, you could also pass on hepatitis A, and it was a few years back, it was said that they were going to try to push an ordinance where everybody that worked in food services should get hepatitis A vaccinations. I highly support that, because we don't want to pass on hepatitis A that can cause damage. Hepatitis A is typically an acute infection, but can be serious and can be actually deadly. Hepatitis B, similar to HIV in that it's transferred through others via sexual activity, sharing of drugs, and drug works. So it's not just the needle, it's the drug works as well. It's the cotton, it's the spoon, it's all that together. And from mother to child during childbirth, sharp objects, needle sticks, breaks in the skin, tattoos, and body piercings. And I've seen a major rise in tattoos and body piercings in the last 10 or 15 years. We just need to let people know, not only do they need to be aware of that their needle is sanitized, because some of the regulations for North Carolina is that they have to have a sanitized needle, but also reusing the ink. If you take the same ink and dip the needle, a clean ink needle into the dirty ink, then you can actually pass on hepatitis. Hepatitis is many, many more times infectious than HIV ever thought about being. And I say that because it's important to know that hepatitis B, although it is preventable through hepatitis B vaccinations, it's not curable, and it can be acute, and it can be chronic, and it can reoccur. So it's important to know that we need to make sure we tell people not only that they keep themselves free from the infection by using clean needles, make sure for the body piercing needles, and also make sure that they use clean ink. It's more contagious than HIV and can be prevented through vaccinations. So please, if you could be exposed, make sure that you consider that. Hepatitis C is sharing of toothbrushes, razors, and contaminated needles with an infected person, unprotected sex with an infected person, from mother to child during childbirth, and any blood transfusions prior to 1992. I said that yesterday, that prior to 1992, the blood was not checked, and it may take up to 20 years for someone to develop any signs or symptoms of hepatitis C infection, so it's important to know to get tested. Tattoos and body piercings, sharing of toothbrushes, sharing of razors, those things like that with someone who may be infected with hepatitis C. You're starting to see more commercials in the last year and a half, 2 years on hepatitis C infections and transmissions. So because there is a cure for hepatitis C now, there are multiple cures. It used to take, the treatment was a year long, and there was no guarantee that you were cured. Now it can be from anywhere from 12 to 24 months of medication, taking it correctly, with fewer side effects, does not require injections like it did weekly, and people can get, but it's one of the most expensive treatments that's out there. I believe a treatment series costs about $28,000 retail cost. I think one of our pharmacists mentioned that they said they could get the medicine for around $28,000. Very expensive, but there are programs out there that can help you get the cost reduced, like the coupons we talked about earlier, programs that help cover some of those costs. Symptoms of hepatitis: constant tiredness, fatigue, sore muscles, headache. Does this sound familiar? We already talked about some of these with HIV and with tuberculosis. Headaches, widespread abdominal discomfort in the upper right quadrant of the abdomen, nausea, dark urine or light clay-colored stools, loss of appetite or weight loss, aversion to some foods, particularly those that are fatty or high in protein or fried. And we don't like fried or fatty foods in the South. I know we don't like those at all. Less common, but you can find yellowing of the skin and yellowing of the white of the eyes, or jaundicing is definitely signs of hepatitis. And we don't have the video because this is for a 6-hour class, but there are videos out there. And let me talk a little bit about pre-exposure prophylaxis. This is the really buzzword that's going on. Ryan White funds will not cover pre-exposure prophylaxis because that means the person is not HIV positive. But there are programs, and insurances will cover pre-exposure prophylaxis. It's for a person that is part of a comprehensive HIV prevention services program where HIV-negative people who are at risk take antiretroviral medications daily to lower their chances of becoming infected with HIV if they're exposed to. To date, PrEP has been shown to be effective in men who have sex with men and also heterosexual men who have sex with men and women, excuse me. And the Center for Disease Control study also is underway to evaluate whether it's safe and effective against reducing HIV infection when injecting drug users. The jury's still out on that, but they said it's definitely possible even for women to take it as well now. So if you know you're at risk, and we still encourage using the condoms and taking this medication, and we don't know what the side effects will be like. We don't know what the long-term effects of those are, since it's fairly new in the last 2 to 5 years maybe. But it's really getting very popular, and it's an option for somebody that wants to get it. Of course, your provider will have to write for that prescription, so you'll have to divulge to your provider that you're at risk activities and why you are in need of pre-exposure prophylaxis. Now, occupational exposures of bloodborne pathogens, as we're starting to wrap up this last little bit. If you have an exposure, number one, wash the area immediately. If splashed in the eyes, nose, or mouth, have them to properly irrigate, or a minimum or 10 to 15 minutes to rinse the eye out. Notify your supervisor immediately and go to your employee health center during regular hours to get treatment, and or go to your local emergency room to get prophylactic treatment if you think you've been exposed to HIV or any other type of infection. Wear gloves during cleanup, wipe up the blood with an absorbent towel, apply hospital-grade disinfectant to the area, discard the towels in regular trash unless it is totally saturated with blood and it's more than 20 cc's of blood. If it's saturated, the towel may be placed in a red bag for incineration or a biohazard bag. And you need to know what a biohazard bag is. And also, never, never, never pick up stuff that are sharp, glass, and metal objects. Never reach into a trash can that you don't know what's in there with gloves or not, because even if you have gloves, they will not protect you against a needle stick. But you need to have gloves on for every other thing. Universal precautions or standard precautions, there's the biohazard symbol in the top right-hand corner. That's usually orange or red in nature. That's usually found on your sharps containers. If you don't have a sharps container, which is a really heavy, thick plastic container, you can use a bleach container. It's pretty good. If you have to, you can use a 2-liter jug. You can use a metal container with a slit cut in the top, and make sure that you can dispose of those so people don't get access to sharp objects. Treat all blood and body fluids as if they could contain HIV, hepatitis B, or other bloodborne pathogens. Universal precautions is defined by the CDC as a set of precautions designed to prevent transmission of HIV and HBV and other bloodborne pathogens when providing first aid or health care. And under universal or standard precautions, blood and certain body fluids of all patients are considered potentially infectious, regardless of what we know about that person, for HIV, HBV, and other bloodborne prevention. This will help you both on and off the job, so it's important that you remember this, that treat all people as if they could have an infection and that you're trying to prevent any infections. Use gloves when blood or other fluids are presented. Latex is preferred, but there's many people that have latex allergies, so you can use non-latex to help that, and it can still be protected. Clean up all blood and body fluid spills immediately. Always use tongs, pan, broom, etc. to clean up sharp objects, glass, metal, syringes, etc. Use eye protection. Use facial mask if you need to. Never use your hands to pick up sharp objects, even if you have gloves. And of course, avoid splashing or splattering of blood or bodily fluids. This is always helpful regardless of who you are. It's going to help you no matter where you are. Universal precautions, this is something we should be common sense, but it doesn't always trigger with us. But never apply makeup, lip balm, contact lenses, or eat or where bodily fluids are present. Always clean your hand prior to these type of activities and after these activities. Utilize soap and water whenever possible, each and every time. And if you don't have soap and water, you can use hand sanitizer, but it needs to be at least 62, that's the number 2% alcohol or greater. If it's not that, it's not going to clean, it's not going to sanitize. And I will let you know that we think hand sanitizers are great for everything, but it's not. There are some infections out there that can be passed on, even using hand sanitizers. For example, Clostridium difficile or C. diff, it can be passed on. You have to use hand-washed washing to get rid of C. diff or Clostridium difficile, and there's others out there. We still encourage people to use hand washing, even if they've used the hand sanitizer temporarily until they can get to a hand washing. Simply put, if it's warm and it's wet and it's not in your body and it's out of somebody else's body and it's not yours, leave it alone. Warm, wet, and not yours, leave it alone. This works for third graders. I know it can work for us. And as we finish up, we have to ask ourselves, success is achieved through meeting the needs of others, and are we prepared for the people that we may serve in our future? Are we prepared to be those individuals that we need to be for those people? And now I'll leave it open for questions.
We can use the Q&A box if there are questions for Al. And everyone thinks about possible questions. We will email out the slides as a seminar, webinar evaluation will be distributed, and a video link as well for future viewing. I think we're nearing the end of the event, and we'll hold the question and answer on be open for a few more minutes. This concludes the webinar. So if you have other obligations, we can feel free to leave. And Al and I will also stay online for a few more minutes to answer any questions that may be out there. And thanks so much for your participation.
I got a question that's on the board here for the Q&A. Emphasis again about tattoos. Are HIV cases related to getting tattoos? I don't have any data on that, but we do have information that you can pass it on through the sharing of the needles, and that tattoos, it's a warning that HIV is possible to get that. I don't have any specifically, but in all the research that I've gone over, that we do want to make sure that people are aware that they can get hepatitis B, hepatitis C, and HIV through tattooing, particularly when we know that the needles have been shared. Particularly we're talking about like prison tattoos, when you have the prison tattoos where they're sharing less than optimal conditions prior to having the regulations set out where we had to have sterilized needles for approved tattoo parlors. So I don't have the information specifically, but I'm glad you brought that up. That will be my next thing, is to find information about tattooing and HIV cases. Thank you for asking that question, and I'm sorry I don't have more information on that. Any other questions? Didn't give us time yesterday for questions, so I definitely want to give us time today for questions. And if we have a question that I can't answer, we can always you can always email me. My information is on the screen there, and you're welcome to send those in, and I can always send those back out and try to answer those questions and maybe get you some resources if you didn't get enough information on this. So thank you. Wait a few more minutes and see if there's any more questions.
thanks again to everyone. And again, Al's contact information will be contained within the PowerPoint slides. And we certainly appreciate your participation yesterday and today. Thanks again.